start, we must introduce ourselves to our client or to our patient. Good afternoon, ma'am. I am Shinton Bridget Angelina. Here's the nurse for today. And after that, we must review the medical record of the patient chart for any complications or any conditions that patient has. After that, we must assess the equipments, the IV lines or the tubes that may affect the procedure during the procedure. After that, we must identify the movements or any limitation movements that patient has. We must also again check the medical record. Okay, and ask them if they are comfortable to do this procedure freely. If they are already comfortable to do this procedure. Ma'am, are you already comfortable to do this procedure? This requires movement. After that, we must perform hand hygiene. Clean gloves is optional. Doing hand hygiene is to prevent the spread of microorganisms. And after that, we must identify the patient using the three identifiers, name, age, and birthday. We must first check the patient chart. And for confirmation, we must ask the patient to state their identity. Ma'am, may I confirm your name?
18 years old.
How old are you?
40.
Your birthday?
May 40.
Okay. And also check the wristband and ask for permission. I would also like to check the wristband. Is that okay with you, ma'am? After checking their wristband and identify their identity, we must explain the procedure to ease the anxiety or the fear of the patient. Ma'am, during this procedure, I will transfer you from bed to wheelchair. Is that okay with you, ma'am? And make sure to get the client's approval and provide privacy. We must close the curtains. I will close the curtains now. And close the door if possible. And after that, we must adjust the bed in lowest position. And make sure the beds are locked, bricks are locked, and from and wheelchair. And after checking the brakes of the wheelchair and the bed, we must load the side rail of the bed. After lowering the side rail, we must ask the patient if they are already comfortable to move. Ma'am, are you already comfortable to move? Okay. And now I will also ask for the permission from the client. Ma'am, I will now remove your comforter. So I will assist you now to in sitting position. After that, we must also again ask for their permission. Ma'am, I will also touch your arm. Is that okay with you? Okay. And assist them in sitting position. So, after that, we need to let the patient rest to avoid dizziness, symptoms of dizziness and fatigue, and let them rest in a few minutes. After a few minutes, ask them how they feel about the procedure that we do. Okay, ma'am, are you feeling okay? Are you not feeling dizziness? No. Okay. And after that, we must let their foot to touch the floor. Okay. After that, we must put sleepers, non-skid sleepers, to prevent falls of the patient and further cause injury in patient and the nurse. After that, you must put the gout belt. Ma'am, I will put now the gout belt in your wrist. That's okay with you? Make sure it is secure to prevent injuries and accidents. Okay. After that, ma'am, I want you to put your arm and put your foot forward to provide support and balance for the patient and for the nurse. Count to 3, ma'am. 1, 2, 3. Okay. After that, we must ask the patient if they are already comfortable. Ma'am, are you already comfortable in your position? Okay. After that, I will now remove the belt. After removing the gout belt, you must use the footrest. And after that, we must document and do the hand hygiene. But before that, we must also provide towel or comforter to the patient lab to provide confidence and privacy. And make sure to ask them again if they are already comfortable and they're feeling okay. Ma'am, are you feeling okay right now and comfortable in your position? And do the hand hygiene to prevent the spread of microorganisms. Make sure the brake is locked. Do not perform hand hygiene. And introduce ourselves to our patient. Good afternoon, ma'am. I'm Shirley Bergie, Pangilinan, your student nurse for today. And identity and explain the procedure. Now I will transfer you from wheelchair to bed. Is that okay with you, ma'am? And ask them for their approval. And after that, you must perform privacy. And close the door if possible. And after that, adjust the bed in lowest position. And make sure also the brake of the bed is also locked. And after that, we must lower the side rail. After lowering the side rail, we can start the procedure now. But before that, we must ask the patient again for their approval and their consent. Ma'am, are you comfortable doing this procedure? So I will start now. Then transferring you from wheelchair to bed. Is that okay with you? After that, now we will remove the blanket from your lap. And now I will put the goat belt. After putting the goat belt, make sure it is secured. And make sure their feet is touching the floor. Okay, now. After that, ma'am, I would like to put my arms on here. But also, it is optional. But, pwede rin na dito kayong humawak. Dito humawak yung patient. But optional din dito kung kaya naman ng nurse. Then, count of 3, I would like you to stand, ma'am, and sit in bed. Is that okay with you? 1, 2, 3. Okay. After that, let the patient rest again. Are you feeling okay, ma'am? And ask them if they have dizziness or what. You have dizziness, right? Feeling dizzy? Okay. Fine. Okay. Let her rest for a few minutes. After a few minutes of resting, we must remove the goat belt. But it also is optional if mapatanggal yung goat belt. Okay. And assist them in lying position. Okay. And now, then provide them comforter or blanket that cover their body. And ask them if they are already comfortable in their position. Ma'am, are you already comfortable in your position? Okay. You. Ask again and do the hand hygiene.